My oldest patient was 46 years old. I helped her get pregnant naturally. I even had a patient recently. She was having all these issues and she got pregnant 2 months later. And that was her issue, was the gluten. Western medicine has brainwashed so many of us that the only option is IVF. That's just not true.
Could you just start by telling us how you got some of your expertise in fertility in your personal story?
Sure. So it started with my own personal journey with fertility. My husband and I got married and we thought it would be really easy to get pregnant. You hear your whole life, you have sex, you get pregnant. That's the way that it works. But for us, it wasn't that easy, as it's not for many people that I talk to every day. We went down the road of, first, we just started with our regular doctor and she ran some tests and told us everything was normal, told us to keep trying, which was super frustrating because that's what we felt like we were doing. So we tried a little while longer. We went back to her over the course of about 6 months. We did some rounds of fertility drugs. We did some fertility procedures, ended up getting diagnosed with unexplained infertility and being sent to a fertility clinic who told us our only option at that point, because by then I was 36, would be to do a procedure called IUI. And if that didn't work, then I would have to do IVF. And that's when I said, wait a minute, there's nothing medically wrong with me. I have unexplained infertility, but you want me to do this invasive medical procedure to get pregnant. And that didn't work for us. So I made it my mission. I dove into research. I started looking into what could be causing this unexplained infertility, because I knew in the back of my head there had to be an explanation. I just needed to find it. And so that's what I did. I researched, I figured out what I was eating wasn't serving me. I figured out what supplements I needed to take. I was over exercising and under eating. And once I kind of put all these pieces together, I figured out how to solve this puzzle. That's why I call it the hormone puzzle. And I ended up getting pregnant naturally, not once, but twice. I had my second baby at 40 years old naturally. And then after he was born, I said, I have to teach this. So I went back to school and started on this path of functional medicine. I became a health coach first and started my business in 2017. And then after that, 2 years later, I became a nutritionist. And then eventually I got my PhD and master's in natural medicine. And I've been running my company for about 10 years now. And I work with people all over the world to help them solve these issues so that they can get pregnant and stay pregnant and bring home a healthy baby.
Amazing. Yeah. So when you're working with people now, what you just laid out, there's a lot of, no, every story is individual, but there's a lot of themes that come up in the fertility world that people run into and seem to have to discover like they're hard won discoveries, like way down the road. And then people often are like, this would have been great to know from the beginning, or like say with the under eating, like that would have been great to try early on because that's it's a non-invasive intervention. It's, can be done from home with a little habit change versus some of these more invasive, involved interventions. So as you're seeing people now, is it similar types of things that are the biggest needle movers, or has it changed over the last 10 years and in current day where you're seeing different things that have the biggest impact?
Yeah, I mean, it depends on the person. Obviously, everybody's different. Some people, it is those foundational pieces that we need to dive into and fix and optimize. Some people, their diets do need to be changed. Some people, it's they're over exercising, like what was happening with me. They're too thin and they're under eating. So sometimes it is that, but now more than ever, I'm seeing a lot more complex cases. I'm seeing a lot more with environmental toxins, and we can get into what that looks like. I'm seeing a lot of estrogen dominance, which can link back to toxins and stress. I'm seeing a lot of adrenal fatigue issues popping up. So even 5 years ago, I wasn't seeing what I'm seeing now. So I would say it's a little bit of the foundational pieces, but it's also, there's more complex cases that we need to dive into.
Yeah. I think that matches what we've seen in the world and with health in general the last 3-4 years. So where do you start? Someone walks into your office looking for help. How do you begin with them, and what helps you? Like you said, each case is individual. What helps you narrow down what might be the biggest factor for an individual?
Sure. So the first thing I do is I just have a conversation with the person. I want to get to know them personally. I also have them fill out a very in depth health history form. I'm looking at past diagnosis, I'm looking at current diagnosis, current lifestyle patterns and habits. And I look at all this information and then I can determine okay, this is somebody that needs some foundational work. We need to really work on diet and lifestyle changes and habit change. But then I also sometimes I'll see, and this is happening a lot more because I think people are getting more and more educated as far as what they need to do for their health. And so I'll have somebody come to me that's doing all of the foundational work, but they're still not getting pregnant and they still can't pinpoint why. And so that's when I'll run functional lab testing. And I know we're going to talk about that today, but this is going to give me a deeper look into what might be causing the issue. And so instead of just guessing at what protocol I want to give somebody, I can say, the labs are telling me this is what our problem is and this is what we need to do to fix it. So I'll dive into that piece a little more. And then it's all customized. Once we do the foundational pieces, everything else is going to be customized based on what that person actually needs and what the labs are showing me that they're struggling with.
Okay. Yeah, I want to dive into the labs maybe just next, but just before that, with the foundations, will the labs inform how the foundations are working, or you do some, is that part of the intake assessment? Because one thing, especially nowadays with how much information is out there and social media and strong opinions and influences, is people get bombarded with information from all different angles. And I don't know if I've ever met a person who's intentionally, not eating well, not sleeping well. There'll be people who are like, yeah, I could do better. But pretty much everyone would say, yeah, I eat pretty healthy and I have, cheats on the side, because people on average, they do. They really want to be healthy and they make an effort. But when someone has like persistent health issue, infertility being one of them, but that they have to keep going back to the drawing board, I find over time, like all of us, this is myself included, you realize, oh, I didn't know that about the foundation, a healthy way of eating, or like these exercise examples you're giving. I find that can surprise a lot of people. Like, what do you mean over exercising? Is that even possible? Like, we're told to exercise, be active, move, and it's can be a shock for people to find out that things that, despite their best efforts and best intent to be healthy, might not be fully getting them there. So will that come up in the intake? I'm curious, how do you help people assess whether their best efforts for their nutrition, for example, is getting it done, or if they need to look and refine a little bit more?
Yeah, it will come up in the intake. I'll look at what their current diet looks like. But a lot of things that I also find is many people are gluten sensitive. I find a lot of people are eating gluten. They don't realize they're sensitive, and that's causing an issue. I even had a patient recently who was a beer drinker, and she didn't realize beer had gluten in it. And she was having all these issues. We helped her get off the alcohol, stop drinking the beer, and she got pregnant 2 months later. And that was her issue, was the gluten. So yes, I look at the intake and I say, are you hitting the foundations? But then the labs will come into play where I say, okay, well, do you have a gluten sensitivity? Do you have a mineral imbalance? Are there other things that we need to dive into to really get that nutrition, not just foundational, but targeted for you and for your fertility and to optimize that?
Okay. So let's dive into the labs then. What
Yeah.
do you use most frequently? What do you find to be most helpful?
Sure. So for fertility, the first place that I'll like to do is I'll do a Dutch urine hormone test. And what this does, it's instead of looking at hormones through blood, which most people come to me, they've already done a lot of blood work. Most of the time, the blood work says normal, but blood work is only a snapshot in time of what's happening right when the hormones are tested. Whereas when we test through a Dutch test, which is a dried urine hormone test, it's not only looking at what your levels are, but how your body's actually using your hormones, how they're being methylated, which means neutralized, detoxed, and excreted through the system. I can also look to see, do you have estrogen dominance? Is your estrogen too high Or is the balance between estrogen and progesterone off, causing an estrogen dominant situation? I can look and see how your adrenal glands are functioning. What is your circadian rhythm doing? All of the pieces that blood work misses is what I'm looking for when I do the dried urine hormone test. So that's usually the first place I'll look is hormones, because as we all know, hormones play a huge factor in all pieces of health, but definitely in your ability to get and stay pregnant. So that's the first test. Then I'll talk to you about your gut and what do you have any gut issues? Now, this can be things like constipation, telltale gut signs, bloating, constipation, cramping after eating, those type of things. But it's also, do you have foggy brain on a regular basis? Do you have any skin issues, acne, psoriasis, rosacea, anything that can show us that there's something going on with your gut? And I will tell you, 9 times out of 10, when I look at the gut, even when people say, I have no gut symptoms, I find things in the gut that are compromising their ability to get pregnant. I find opportunistic bacteria, fungus, parasites, even short chain fatty acid production that's compromised. Their vitamins are being compromised. So the gut microbiome analysis is the second thing that I will recommend to most of my patients. And then the third thing that I usually will do, there's two options here depending on the patient. If they are over 35, I will usually recommend that we do a DNA analysis, which is looking at 46 different genetic SNPs for fertility, pregnancy, and postpartum. So I do that after 35 because a lot of times as we age, as I'm sure you know, our DNA starts to age, we have oxidative stress, things are compromised, and we really need to look to see, is there anything that we can do here to optimize our DNA so that we can turn on the good DNA, turn off the bad DNA, which is going to help us with getting pregnant, staying pregnant, and the health of our future babies. So if they're under 35, usually I will do a hair tissue mineral analysis, looking at mineral status. Most people are mineral deficient. So I like to look to see, what does your minerals look like? What do they look like in tissue, which is hair, versus blood, which blood is just a snapshot in time. Again, it's also a transportation vehicle. So I really don't like minerals in blood. Looking in the cells of the tissue is going to give us a better representation of what the mineral status actually is. So those are probably my four main tests that I run on most people.
Like the gut is interesting because you're working specifically with fertility, right? And so people
Yeah.
may wonder, what is my gut? What does that have to do with my gut? Can you speak to that? As a matter of just, if your gut's not working, your health can't be
Sure.
optimal, and that's going to drag on everything.
Sure. So many processes start in the gut. The first thing is 90% of your immune system is housed in the gut. So if your immune system is compromised, it's going to cause something called a leaky gut, which is going to cause overall systemic inflammation. If your body's inflamed, it's not going to feel safe enough to get pregnant. Everything's on high alert. So it's going to downregulate your fertility hormones. It's going to downregulate your ability to get and stay pregnant. So that's kind of the first piece, is I'm looking at, do you have any inflammatory markers that we need to address? And now this isn't just for fertility, although that's what I'm working with is fertility patients. But if you're inflamed and you have a leaky gut, this is going to compromise your health at every age of your life. So getting it looked at now when you're struggling with infertility is only going to help your health as you age. So that's the first piece. Then I'm also looking for, do you have dysbiosis? The gut is controlling how you're able to metabolize your food. And if you're eating a good, healthy diet, but your gut is compromised, either you have more bad bacteria than good bacteria, which is called dysbiosis. Maybe you have an opportunistic bacteria that's crowding out the good bacteria. This is going to compromise your ability to absorb those delicious nutrients and those wonderful nutrients that you're eating, which is going to cause your body to have overall issues with how it's able to perform. You have to have nutrients for every system in the body to perform optimally. So that's another piece of why we want to look at the gut, rule all of these pieces out so that you are getting all the nutrients and your body systems have everything they need to function optimally. And so those are probably the main things that I look at. I also want to see your short chain fatty acid production. And short chain fatty acids are microorganisms that your gut creates based on your food. And it can lean towards either saccharific fermentation, which is a low inflammatory state, or proteolytic fermentation, which is a high inflammatory state. When you're leaning this way, your body's creating a lot of inflammatory bacteria, such as lactase and hydrogen sulfide, and your ability to detox your estrogens, which all of these things are going to compromise your ability to get and stay pregnant, but also your overall health, as we've already discussed. So the gut really plays a huge role in all aspects of health, but definitely with fertility.
Okay. And what was that last piece you said? That's called proteolytic?
Proteolytic fermentation.
Proteolytic
That is
fermentation.
your short chain fatty acid production leaning more towards an inflammatory state.
Okay. Yeah. Okay. So let's take a step back to go to the hormones. If someone's coming to you and having fertility issues, are there always going to be hormones that look off or not necessarily?
9 times out of 10, yes. Most of the time, it's either estrogen or progesterone or both. Sometimes it's an androgen issue. Sometimes it's your adrenal gland function and hormones. Sometimes it's your thyroid hormones, but a lot of times we can rule that out through blood work. I will say that blood work for thyroid, if it's a full panel, is going to show us what we need. Now, I do test through urine, but that will also show us, but sometimes it's cheaper to just run a blood panel through your doctor, your Western doctor. So, but yes, usually it's a hormone issue when there's fertility issues involved.
Okay. And what you've described so far by you working with people is it's integrative, holistic. It's full picture. And I completely resonate with what you said just about the gut. Like, look, if it's a problem now, like yes, maybe fertility is what brought you in and to look at it, but it will just continue to be a problem and it will affect something else in the future, not just fertility. So I totally on board with this, just full health approach and like let's be as healthy as we can and live the most, fulfilling, healthy lives we can. But for fertility in particular, like there's often urgency behind it. There's like a very clear, I don't know, goal or outcome that people want. Again, I come from a little bit more of like the chronic health background where it's just like I just want to feel like myself again. I want to be able to think. I want to be able to get out of bed. And so there's goals there too, but it's a little bit more of a progression where people can, going back to the hormones with IVF or more conventional treatments, like sometimes that can push people over the line and allow pregnancy to occur. It may not fix all the underlying health issues, but if the goal or the first thing that's being done is to conceive, that sometimes happens. So are the patients you're seeing, where do you fall in the spectrum? Are they come in and say we want to do this in a more holistic method, or are they just kind of just maybe the way you were, like they've tried with their doctor, they've been told something, keep trying and gotten frustrated and then say, hey, let's look outside the box. I'm wondering if people are on board with the holistic plan, or if there's still a little bit of urgency and how you navigate that.
Yeah, I think it really just depends. There's so many different patients that I work with. Some people come in and they just want to do natural and they're looking for that integrative, holistic doctor that's going to help them walk through this naturally. Maybe they've done the Western medical route, they want to try the natural route. But some people come in and they're going through IVF, but they want to give their body the best chance of it working. So we come right alongside them doing IVF. I'll run some labs and say, okay, these are the things that we need to fix, before you go into your next IVF cycle to make sure that it's going to be successful this next time. So I would say I like to meet the patients where they're at and whatever they're looking to accomplish, I want to be their guide and want to come right along with them to help them accomplish that, whether it's naturally, whether it's through assisted technology, wherever they're kind of leaning. But this process can help with either piece of that.
Yeah, yeah, very cool. It's like wherever they're at, they can get a boost, and again, it's going to have some downstream effects beyond
Yes.
just conceiving too, which is awesome.
Yeah.
Okay. And then for you mentioned the DNA analysis. Is that more of an epigenetic test where it shows here's what's going on now, or is it the SNPs and the genes and there's truly the underlying DNA that's going to affect some of these aspects of fertility?
Yeah, so it's 46 genetic SNPs that are going on right now. But then as we see which ones are compromised based on their DNA, then that's when the epigenetic lifestyle pieces come into play. And we say, okay, you have an MTHFR gene mutation. We need you on a good methylated folate to make sure that you're not B vitamin deficient. It's that type of thing where we're looking at the genetics, but then saying, okay, this is how we optimize those genes that we need on or off based on diet and lifestyle. Yeah. And so the ones we look at are 46 different ones for your ability to get pregnant, your ability to avoid miscarriage, your ability to avoid things like preeclampsia, gestational diabetes, even things like having a low birth weight baby. We can look at the genetics and say, okay, you have this genetic SNP that's going to predisposition you to a low birth weight baby. Let's give you some nutrients and things that can optimize that so that doesn't happen. So it's a really cool test. It's called Grow Baby, and it's from DNA Labs, and so it's one that I run a lot. So I really like it.
Yeah, yeah, and that's some powerful info to know.
Yeah.
In the case of the propensity for a low birth weight baby, is it mainly nutrients, increasing nutrients, or are there other support for that?
Yeah, so nutrients, there's supplements, there's lifestyle factors. And so that one specifically, if you have a genetic SNP for vitamin D deficiency, so even if you're taking vitamin D or you're getting a lot of sun, there's specific genetic SNPs. And I'll have to go back and look. I don't know all the genetic SNPs because it's like all these Greek letters. But the one that compromises your vitamin D is going to cause you to have a low birth weight baby. So if you have that genetic SNP turned on, we need to give you more vitamin D, maybe do higher dosing, even up to 10,000 IUs to make sure you have what you need so that doesn't happen. Your baby has a good birth weight. So, yeah.
Yeah, yeah, yeah. Is that vitamin D through the pregnancy or up to conception and then depends?
Yeah, so I would say if you have a genetic SNP for vitamin D, you're always going to have it tested. I would do 10,000 IUs up through pregnancy. And then after you give birth, kind of have that blood work done pretty regularly every 3 to 6 months to make sure you're not going down. But you're always going to have vitamin D supplementation because your DNA is compromised for vitamin D. Same with if you have MTHFR, you're always going to have to take methylated folate because your body's never going to be able to it's not going to be able to transfer folic acid into folate, and you're going to be vitamin B deficient. So we need to make sure that you're always supplementing if you have genetic SNPs that are compromised.
Do you ever see that change with those two, the vitamin D or vitamin B, as people get the lifestyle pieces more dialed in? Say they get their nutrition optimized, stress reduced, sleeping better, or particularly in like detox, like if the liver starts you lifting some stress is lifted off the liver, will the need for supplementation ever, well, one, will it ever go away if they have a snip, or two, if not, do you ever see it decrease, or are you not seeing that long enough because you hope people conceive and then that's kind of the end of the road?
Yeah, so I would say if they have a genetic SNP, they always are going to need to supplement. Now, do they need high dosing if their lifestyle and their diet is, on point? Probably not. They're always going to need a little bit of help just because they have such a hard time, moving the food sources into the usable forms because of those genetic SNPs. Mhm.
Okay, gotcha. And so how about the with detox, and you also mentioned, I believe, like hormones and recycling or binding the hormones. How do you identify that on the hormone test, and then what are maybe the top couple ways that can be supported?
Yeah. So I really like to look at your phase one and phase two metabolites on how you're detoxing estrogen. And I look at phase one, I like to do the analogy Phase one is like a bathtub. Your body's always making estrogen. It's primarily made in the ovaries until you hit menopause, but it's also made by your adrenal glands and it's housed in your fat cells. So as we start the process of detoxing, especially estrogen, which is really important for cancer prevention and making sure we're not estrogen dominant, we want to detox down a pathway called 2OH. This is your anti-cancer pathway. So I like to look on the dried urine hormone test and see if at least 73% of your estrogen is detoxing down that 2OH pathway. If it's not, there's also a pathway called 16A. If you're leaning more towards the 16A pathway, you have more than 20% detoxing down that pathway. This is going to make you more susceptible to estrogen dominant cancers. Cancer can grow. This is a proteolytic pathway, so it's going to cause things to grow. It's really good for your bones, but it's bad for cancer. So I always like to look and say, okay, are you at 73% on the 2OH? No more than 20% on the 16A. And if you're not, then we can use something called sulforaphane to move you from 16A to 2OH. And this enzyme is meant directly to help with the detox of the estrogen down the correct pathway. So that's your 2OH. There's also something called 4OH. This is more hereditary. We want to see it no more than 7%. There's nothing you can do with this. It is what it is based on your genes. So I like to look and say, okay, is this any higher than 7%? Most people, I don't see that. That's usually not an issue. It's usually the 16A that's the issue. So that's phase one. And then phase two is actually your drain and your sewer line, how estrogen's leaving your body. It goes through the liver, then through the gut, then through pee or poop. So we want to make sure that our 2OH isn't compromised. Now, this also ties into the MTHFR gene that we were talking about earlier, because that gene is going to make you not be able to methylate your Bs, which is going to affect your ability to methylate, which is neutralize that estrogen and detox it out of the body. So anytime I see the phase two metabolites that are compromised, there's a little graph where it'll show if it's leaning more towards the red, that means that you probably do have that genetic SNP. If we haven't run a DNA test, if we have, then we can confirm that. But we want to make sure that if you're not methylating and detoxing, that you have good support there, again, with those methylated B vitamins. Now that's your estrogen. Now, overall detox, I recommend doing things to support the liver, to do things to open the detox pathways. So how do we do that? We support the liver, good herbs like cilantro and parsley are really good. Sometimes if I do run a test for mycotoxins, I'll look and say, okay, do we need something more, stronger, like a binder or something with bentonite clay or, charcoal or something like that? Do we need to use something like Cellcore, which is a really hardcore detox product. So that's what I'll recommend. And then for the other detox pathways, anything you can do to make yourself sweat, that's going to be very important. So saunas and steam rooms and salt rooms and anything that kind of open those pathways. I also love dry brushing and castor oil packs for detox. So anything you can do to open those pathways, help your body to naturally detox. And then if you need to bring on a supplement, that's going to be important too. So those are really the things that I work on when it comes to detox.
Yeah, amazing.
There's a
So a
lot.
lot of yeah, I mean that's why people come see you, right? Because
Yeah.
there's a whole world to
A lot.
navigate, and yeah, I mean it's just so valuable for when people can get pointed, say, okay, here's the direction. Because I mean, even just
Yes.
with what you mentioned, is just gonna overwhelm most people who that's not their expertise. They're not living and breathing it. So when you start people, do you start with the hormones? Do you start with the lifestyle? Do you do it all? And how does your team in your office lay out a plan for someone to to manage all these different variables and focus on the right things for them?
So we have a free call that we do, and then we also have a paid call. The free call has a brief health history form where we just jump on a phone call. I look at the health history and say, okay, we need to dive into a deeper health history form here, or these are the tests that I recommend. So that's for the free call. If we do a deep dive call, is what we call it, we'll have you fill out a full health history form. You'll submit any previous lab tests to us, and then I'll get on a call with you over Zoom. I'll go through your previous previous labs. I'll look at your health history, and then I'll recommend if there's additional labs that you need, we'll talk about that. Or if we feel you are a fit for one of our full 12-week programs, we'll have you do that where we meet weekly by phone. We run all the labs, but then we walk you through the protocol and program. It's more hand holding, more support, more accountability and community. So it just depends on what, again, every patient's individual. It depends on what they need. It all starts with a phone call with me, and I'll kind of determine, okay, you do need further lab tests, or you do need somebody to help you with these foundational pieces, maybe plus labs. And then we'll kind of go from there. But it really depends on what the person needs and which direction we recommend based on that.
Okay. Yeah. So you've mentioned adrenals and stress a couple times throughout. How, I mean, roughly how often is that a piece of someone's picture? And again, it probably is also, unique and different for every person, but are there some more common ways you address that, or maybe start to address it and then, go further down the rabbit hole if the first couple things don't get the shift they need?
Sure. So I would say 80 to 90% of people that I test have adrenal fatigue. It is
Wow.
insane. Now, what's driving the adrenal fatigue is where I like to look. Is it a toxin? Is it, overall stress? Is it a past chronic illness or, previous multiple IVF cycles? Or is it something that you've done physically to stress the body, mentally to stress the body, or is it something internally like a toxin or, a parasite, a fungus? What's driving it? So a lot of times I'll look to see, okay, you have this, what's driving it, and then that'll tell me what we need to do to fix it. But overall, sometimes just talking to a person, they'll say, I know I'm stressed. I have a very stressful job, or I have a very stressful family situation, or, I've had a death in the family or something. They know what's causing their stress. And if that's the case, then I help them work through that with removing the stressor if we can. If there's something we can put on the back burner, I always tell people you probably can't quit your job or break up with your mother-in-law, but you can put boundaries in place and put them on the back burner, or put that on the back burner while you're trying to conceive. So we'll work to remove the stressor, but then also I'll help them put lifestyle pieces in place that are, shown to actively manage stress. Are we doing deep breathing and diaphragmatic breathing? Do you have things in your life that bring you joy? Are you going for a walk? Are you, being out in nature? What do you love to do? That's going to help alleviate some of this stress and pull you out of adrenal fatigue. And then I also have diet and lifestyle recommendations based on adrenal fatigue. I have some fun little mocktails that I'll recommend that have a lot of minerals in them that will help support the adrenals. I'll, do things like that, different foods that also will support the adrenals. High vitamin C and vitamin E foods are really good nutrients for the adrenals. So diet, lifestyle, managing stress, and finding out what's causing the stress in the first place is kind of the protocol that I'll take somebody through.
Okay, nice. So yeah, it sounds like that awareness and focusing and just taking some time to
Yeah.
minimize the stressors can help move the needle for people. Because I like who comes in it, like anyone you talk to, like it would be kind of odd if they're like, yeah, I'm not stressed at all. Like I'm totally relaxed all the time. Like it's just our standard operating way. So I find that yeah, most people will acknowledge that, but then it's like, okay, well, something has to change to shift it up. And speaking of the mocktails, I think I've drank more adrenal cocktails than actual
Yeah,
cocktails in my life at this
right.
point.
I know I
And
used to
they're
call
not
it a
bad.
cocktail. Yeah, I used to say a cocktail and everybody be like, "Well, I don't drink alcohol." And I'm like, "No, no, no, it's not alcohol." So I changed it to mocktail.
Yeah.
Yeah.
Yeah. So when the stress comes from, or in part is driven by toxins, do you also have some functional labs you like to run for toxins? And if so, what are the big players that you see more frequently with people?
Yes. So I love to run the mycotoxin test. Sometimes I'll do a full Motox, which also looks at organic acids. Just really depends on that health history and what I see people struggling with. But I definitely run the Motox test a lot. I'll find different toxins that are related to mold. I just ran a test recently on a lady who's been trying to get pregnant. She's 43 years old and she had the orchotoxin A. I mean, so high. And I said, do you have any mold exposure, any mold in your environment? And they just remediated their bathroom and it was full of mold. And I said, well, yes, it's in you. And that's probably one of the issues with your fertility. She also had MTHFR. So those two things, she had been to 6 other Western doctors. Nobody had told her either one of these things. And these two things directly relate to fertility. So as she's working to fix it, this could be her main issue with her fertility problems. So that's probably one of the things that I find. Gliadin toxin is another one that directly relates to fertility. That one causes a lot of issues with immune system. It can cause gut dysbiosis and it can cause some reproductive sex hormone issues as well. So those are probably the two main ones that I see. And then the detox is similar to what I said earlier. You know, sometimes I'll do a binder, I'll do glutathione, sometimes I'll do Cellcore if I feel like that's warranted, if it's, a really bad case. And then all the detox pathway work that we already talked about.
And with the mycotoxins, are you ever seen that be an issue from food, like the mycotoxins that are more prevalent in food? Or if that's an issue, it's usually like a water damaged building and that side of the mycotoxins.
Yeah, the gliadin toxin actually comes from foods. It's oats, barley, rye, corn, I think is one of them. So there's a handful of foods. So, yes, that one I see a lot. And that one directly impacts fertility. So, for
So
sure.
is that now, of course, these are people's like favorite foods, right? The grains and everything that's made
Yeah.
from them. In general, is that part of your nutrition plan, or only like to remove or reduce those things, or is it only in those examples, the corn and oats, or is that only if they have elevated mycotoxins and the whole clinical picture adds up to saying, hey, this is going to give you a lift and it's probably worth doing?
Yeah, so it really depends on the person. Obviously, I want everybody eating organic if they're eating those foods. Definitely make sure they're clean and season, health. They're sourced in a healthy way. I do recommend all my patients, I'll say all, most of my patients, I want to avoid gluten. Most people have a sensitivity to gluten. So the wheat, barley, and rye, that's out. But the other, grains have some good properties. If it's a quinoa or, some sort of oats, gluten free oats, some of these grains and oats are actually good. So it really depends on the person. I have everybody do a reset in the beginning where it's a reintroduction, a removal, and a reintroduction. If they don't have a sensitivity to grains, sometimes we'll run a food sensitivity test even to look to see deeper if they have a sensitivity. If they don't, I think they can have some of those foods in. I feel like sometimes it gets so restrictive. We want to make sure that all the good property foods, even if those foods sometimes can have some toxins, they can eat them if they're not sensitive. So that was a long way to answer your question, but I think if you're not sensitive to some of these healthy grains, I think they have a place in the diet. But definitely make sure they're organic and clean and sustainably sourced.
Yeah, yeah. Well, I think it's worth the discussion because it
Yeah.
stresses people out. And like I said, some foods they love, and I totally agree. Like too much restriction. That's speaking of
Yeah.
stress. That's another form of stress. And I mean, you read enough info out there, you could make an argument to cut every food out of your diet, which obviously is really not healthy. So how
Right.
to balance it. So yeah, I think it's refreshing when people have a pathway to do that if they're not reacting and seem to be doing well. Once they conceive and become pregnant, then are you? I don't know how much if that's where your work ends or if you continue working with them through pregnancy. What I'm curious in is if people tend to then continue with, especially with some of the lifestyle stuff, or if they've achieved the becoming pregnant, and then it's up to them where they want to go from there.
Yeah, so I actually work with pregnancy and postpartum patients. And so a lot of our patients will stay with us through that process. And our program is definitely for fertility optimization and pinpointing what's causing fertility issues. But I always like to point out this is overall optimizing your health for the rest of your life. So, yes, we're trying to get you pregnant right now, but everything we teach is for this is a lifestyle now. You're not going to go back to eating garbage. You're not going to go back to, drinking alcohol every night. You're not going to pick up any of these bad habits that you might have had when you came in here that you were trying to get rid of to get pregnant. This is a lifestyle. This is what you're going to sustain for the rest of your life. Now, that being said, I also teach 80/20. I feel like 80% clean whole foods and clean lifestyle. 20%, we have to have some things that we love in our lives. So if you like to enjoy a glass of wine, if you like a piece of chocolate cake, I'm not saying you can never have any of these things that are supposedly bad for us, but it's just more moderation. It's what you do on a daily basis that's going to add up to optimized health and fertility, and then save a little time for those fun things and enjoy yourself.
Yeah. Yeah, that's great. I mean, obviously, you want the baby to be healthy after birth and through childhood and all that. So that's, great. It's not just the conception, but onward and beyond that, the good health
Yeah.
can support. I'm gonna circle back to the HTMA, the hair tissue mineral analysis test. What are what are some common things you see there? And then if I don't again, I appreciate how individual focused you are. That's probably why your clients like working with you. It's probably a different experience than what they've had before. But do you tend to see any trends on that, or it'll all average out because everybody's different? Some people are high in calcium and some people are low, for example.
Yeah, so it is all different based on the person. It's based on where they live and their lifestyle. And many of it, a lot of it's very different. But I do see some patterns. A lot of the patterns I see is going to be something called a slow one. And this means that the way they're metabolizing their minerals are just slow and low. Now, again, we have to go back and say, okay, well, why is this happening? What I find a lot is it's toxicities. They have heavy metals that are clogging their cells. They have the orchotoxin A, some mold toxins or spores, some things in those cells that's clogging their ability to take in the nutrients and have balanced nutrients. So everything is just really slow and low. So I see that the most. And how I treat that is I'll help somebody really obviously we start with detox, getting out the detoxing the heavy metals, opening up the cells so they can bring in the nutrients, but then really fueling the body with the four main minerals: calcium, magnesium, sodium, potassium. Those are the four that I find that are usually the lowest, and those control every other mineral in the body. So making sure the cells are open and ready to absorb these nutrients is going to be the best bet in getting those minerals back into balance.
With not just with HTMA, but with your functional tests in general, how frequently do you retest, and you do it with everyone or not necessarily?
Yeah, so I always recommend symptom reduction is the best indicator that things that we're doing is working, because these tests are expensive and a lot of times insurance doesn't cover it. So I like to run these tests in the beginning to get a baseline, and then we see, okay, is your symptoms reducing? Do you get pregnant? Is your adrenal fatigue getting better? Do you have more energy? Is your gut performing better? Are you, going to the bathroom regularly? Are you sleeping well? So all of that will tell us the work that we're doing is working. Now, some people just want to see the data. And if that's you, I would say about once a year, we retest and see what's going on. But it's not necessary to retest as often as maybe you would do some blood work, just because it is expensive. So symptom reduction is the best indicator. Yeah.
Right. Yeah, that makes sense. Have you ever seen cases where there's clear symptom reduction? People are like, feeling better, enjoying life. Thank you. But then their hormones either aren't moving or still staying in a range that's outside of what's going to support fertility.
Oh, obviously, yeah. Sometimes, I say 90% of the people I work with, they feel great. They have great energy and sleep and, all of the things we mentioned earlier. Most people experience that. Now, sometimes it takes a little longer for the hormones to come back on track. Sometimes it takes longer for the gut to come back on track. So it really just depends on how the body responds to the treatment we're giving it. But people do feel better initially in the beginning. So I always say it's easy to keep doing the things that you need to do to make sure that this is working if you're feeling good in the process. So to answer your question, yes, it really depends on the person, but um, yeah.
Well, thank you so much for coming on and sharing, different perspective and the way you're helping people. If someone wants to work with you or follow more of your work, what's the best way for them to do that?
Sure. So they can go to our website, hormonepuzzlesociety.com. And on that website, we have many different giveaways, free digital downloads relating to hormones, fertility, and pregnancy. They can also book a call with me right on the first page of that website. So book a call if you want to talk further and learn more about my services and how we work here. You can also find us on social media. So I'm at Kela. Kela spelled Kela. So Kela underscore health coach is my main Instagram account. That's where I have my most fun and share the most content and different pieces around fertility education and hope and just really we have a lot of fun over there. So follow us over there. I also have a Facebook group, which is Kayla Health Coach on Facebook. You can also follow me and listen to more tips and tricks for fertility optimization on my podcast, which is called the Hormone Puzzle Podcast, and it can be found everywhere podcasts are heard.
All right, great. We will link to all that in the show notes. So if you're listening and want to find it, just scroll down and click on the links. And Dr. Kayla, thank you again.
Yeah, thank you.